Well, some new information has come out about the utilization of marijuana. Now, I realize marijuana is a big topic people talk about, but a new study has just been released by an Australian research group, and they've been researching since 1980 to 2025, multiple, and I've had 54 studies they've done, says that people who are prescribed marijuana for mental health issues doesn't work. Now, I'm not saying that it doesn't work for other things, and that's what they're saying also. But they said when it comes down to studies, using marijuana does not improve mental health conditions, things like anorexia nervosa, bipolar, obsessive compulsive disorder, OCD as they call it, psychotic disorders like schizophrenia. Marijuana does not help in those situations. Now, are there other things available that could do that? Yes, there are. And other people can be prescribed things, but right now, most of those doctors out there on the medical marijuana are prescribing it for people in their mental health conditions, not because they have any other situation. However, state of Indiana has been reluctant about legalizing marijuana, even though you go to Ohio, you go to Michigan, you go to other states, like 35 states have already legalized it, but Indiana says, not doing it. Not even medical marijuana. And I will tell you, I happen to know that medical marijuana, in many cases for people that are on chemotherapy, actually helps a great deal. And that can help people with certain other situations. And frankly, for those folks, yeah, I understand your problem. And frankly, medical marijuana wouldn't bother me if they prescribed it. But prescribing it for mental health situations, the studies, and these have been published in Lancet, been published in JAMA. These are the big places, the big prestige locations saying, doesn't work for mental health situations. Physical situations, totally understand. But since the latest story says that more and more people are quitting alcohol, and I thought to myself, okay, if they're quitting alcohol, what are they going to? Well, apparently a lot of folks are quitting alcohol and going on to marijuana. They said, well, it doesn't kill you, because alcohol will kill your liver and make you die, and that's not a good plan. Marijuana, well, the problem is that I see it, too many young people. You get young kids getting into this stuff before their brains have even developed, you got yourself a bad problem, just starting for you. You get somebody who's addicted to this stuff at an early age, and can you become addicted to marijuana? The studies say yes. I'm not a doctor. I'm just telling you what the studies are saying that I'm reading. However, there is a value to it. Like I said, in some medical cases, it certainly can be. Will Indiana change their laws? I don't know. Federal law, that hasn't changed yet, and I don't know what's going to happen here in this state. But yes, people are getting off of alcohol. The sales are gone down. The numbers show it. They're going to something else. Well, could it be marijuana? I don't know. But keep in mind, the doctors who are prescribing marijuana for people with mental health issues, like the OCD and the bipolar, bad plan. The marijuana today, and this is something to take a real serious look at. The marijuana today, as compared to the marijuana in the 1970s. When I was young, I think the content of THC in marijuana was like 4%. That's what it was. They call it ditchweed, for crying out loud, back in that era. Today, it could be as much as, you ready? 35%. Because the growing, the horticulture on marijuana is being done today, being grown the way it's being grown, it is now so much more powerful than that stuff back in the 1970s. And that stuff can, in fact, cause addiction to some people, not everybody. But are we going to change? Are we going to adapt things what the rest of the nation is doing? I don't know. But as far as mental health goes, it ain't good for that. Is it good for some other things? Yes, it is. And will it become medically available? I don't know. But right now, Indiana is behind the power curve to many people. But until the U.S. national law changes, not sure anything's going to change in Indiana. And now, well, you know.